The emergency department is used for treating true pediatric emergencies. They work in conjunction with urgent care centers and also family pediatricians to collectively provide care for children in the community. If parents suspect that there may be an emergency, it is recommended for them to call their pediatrician first to describe their child's symptoms and condition, and then their pediatrician can recommend to the family whether the child might be more appropriate to be seen in an urgent care setting or if they would need to come directly to the emergency department. Child life is important in the ED, first of all, to help make coming to the hospital less scary for children and their families. When facing an emergency, it's easy to be very anxious and not know what to expect or be able to explain what's going on to the child. And Child Life is available to help decrease some of that anxiety through answering simple questions that the parents and the child may have about what's going on, and at the same time offering distraction activities and procedural support to help the child through any kind of tests or procedures that they might have to go through as part of diagnosing and treating their condition. We help children and families by, first of all, giving simple explanations of what tests and other procedures the child might be going through. We are able to provide simple comfort items to help the child and the family feel more comfortable while they're actually in the emergency department, and just help them overall cope with facing a possible medical emergency or a admission to the hospital, just really kind of navigating the medical system. For parents, when preparing for the a trip to the emergency department, it's important to arrange childcare for other siblings in the family, just to prepare for a possible extended wait time while the parents and child are in the emergency department. It's also helpful to remember a list of medications that the child is on, and to remember to bring any types of formulas or clothing, anything that is specific, to that child that they would need over the next span of a few hours. And it's also important to remember to bring a comfort item, whether it be a blanket or a stuffed animal, just to help that child adjust and cope to being here. They can expect to be greeted by a team of doctors, nurses, and patient care technicians who will in turn examine their child, collect information such as vital signs, and probably ask a series of questions about the child's condition so they can make a more informed diagnosis as to what might be going on. They can also expect to wait for a period of time which may range from under an hour to over a span of a couple hours, just depending on the amount of the number of patients that are coming in to be seen, and also the severity of the other symptoms that the other children may be having. For instance, if there's a child having trouble breathing, they would have to be seen first, which may in turn delay their child being seen. Parents may also want to expect possible discharge of their child. Sometimes the doctors like to keep their children under observation for a period of time, just to monitor them, make sure that they're doing well and they're improving, and then they will discharge them with follow-up with their pediatrician. Or if they feel that their child may need more intense monitoring, they will actually admit them to the hospital for a period of time to be monitored on one of our inpatient units, which can sometimes catch parents off guard. So that's another possibility that they might want to plan for.